class on head development. Try to stay awake. The skull took millions of years to perfect and about 5 minutes of embryology to mess up. Everybody lies, but embryos don't. They just follow gradients. So first question, if the skull is one bony helmet, why does half of it act like it went to art school while the other half enlisted? Neural crest versus paraxial mesoderm. Which parts of the skull are the free-spirited neural crest derivatives, and which come from the rule-following paraxial mesoderm that forms the base and some calvarial bits? And why should you care when a puppy shows up with a face only a geneticist could love? Picture neural crest cells migrating like tourists with no map. They build most facial bones and connective tissue. If they get lost, your patient gets midface hypoplasia or a cleft. If paraxial mesoderm in the skull base fuses early, brachycephaly, short snout, airway drama, and an owner who says he just breathes like that. Do you accept that, or do you ask what premature suture closure does to growth vectors and why the mandible arches dorsally to compensate? Now, arches, pharyngeal, not St. Louis. Each has an artery, a nerve, cartilage, and mesenchyme. If I tell you first arch, do you reflexively say CNV, muscles of mastication? If not, chew on that, literally. Second arch, facial nerve, muscles of facial expression. Third arch, glossopharyngeal, stylopharyngeus and friends for swallowing. Fourth, vagus, laryngeal muscles that let you complain about your tuition. How does matching muscle groups to their cranial nerves help you localize a lesion when the face droops but the bite is fine? Facial real estate is parceled by prominences. Frontonasal does the forehead and bridge, maxillary gives you cheeks and the lateral upper lip, medial nasal forms the philtrum, lateral nasal shapes the alley, mandibular closes the curtain as the lower lip. If the maxillary prominence ghosts the medial nasal at the fusion party, what do you get? Just a cleft lip, or does the defect invite the palate to join? Palate time. Primary palate forms when the medial nasal processes meet on the midline. Secondary palate is a speed date between lateral palatine shelves that must elevate, rotate, and fuse fast. What drugs, genetics, or mechanical factors keep those shelves from meeting, and how does timing explain a primary versus secondary cleft? If only the lip is involved, surgeons play hero. If the palate joins, what happens to feeding, speech, and recurrent infections? And how do you plan airway and nutrition before anyone touches a scalpel? Final thought, you can memorize lists or you can see a map, which is more useful when the next cute brachycephalic arrives cyanotic and the owner says he's fine at home.